Hello, welcome. This is Ajay Agarwal. So in this video, I'm going to discuss about the regulatory requirements and guidelines for establishing a new radiotherapy facility in India. So let's get started. So the objective is to establish a radiotherapy facility compliant with AERB regulations. So for this, you require these three documents. The first two documents are the documents which contain regulatory requirements for establishing the radiotherapy facility. And the third document is actually provides a detail of all the consent that should be taken from ARB during the process. So for this, the ARB has provided for the making the process easy. The ARB has provided uh, e-portal which is called ELORA, and the portal can be accessed through ARB website www.arb.gov.in. So this is an important portal for for any radiation uh, worker or facility, because all the communication will be happen through this portal only. So, so first of all, the institute for establishing a radiotherapy facility. The first thing is the institute has to look for a site where radiotherapy facility is to be established. The chosen place should not have occupational population near it, uh, and the detailed requirement are given in the ARB safety code. Like all the requirement that should be followed for choosing a site for establishing a radiotherapy facility. Then after deciding the site, the institute decides the machine that to be installed. The institute should make sure that the new radiation generating equipment or LINAC to be installed is type approved by the ARB, or NOC is issued by ARB to the local supplier. So the machine should have a type approval from the ARB, and that slip should be with the local supplier of the machine. Then of course uh, the location and site, deciding the after deciding the machine, the institute has to register on the EORA portal for and obtain their credentials for further communication and submitting all the details during the process. So on the basis of high energy of the equipment, so suppose we have the institute brought uh, a true beam, then for true beam the highest energy is 1500. So on the basis of its highest energy 3D calculations are done, and a room layout and site layout is prepared in consultation with the medical physicists, architectures, and supplier of the unit. So after submitting the layout, construction can be started. So you have to submit the layout to the ARB website, ELORA portal, through ELORA portal, and the construction can be started. So for our radiotherapy facility, the main pillars are radiation oncologist, medical physicist, and radiation therapist. So the institute has to fill these positions, and among them, RSO is a crucial person, just like a hero of a movie. And for its nomination and application is to be submitted to ARB. So an application has to be submitted to ARB through ELORA portal for RSO nomination. Now for the safety of staff and facility, institute has to purchase the TLD badges for each staff and submit the details to the ARB. So they has to buy a TLD badge for each person, each staff. So there are two details about the TLD providing labs. In southern part, Eventech provides the TLD badge, and in western part, Renentech provides the TLD badge. So for the safety of the facility, institute also need to buy surveymeter, gamma zone monitors, and dosimetric tools like ionization chamber and radiation field analyzer for data collection. Then it's come the procurement and installation. So for buying radiation generating machine, institute has to take permission from ARB for buying the machine, and then install the machine. The machine should have type approval, and after installation, do mechanical and electrical test, and submit the procurement receipt within 15 days to the ARB by ELORA portal. Then next come is commissioning. So the institute has to take a commissioning approval from the ARB, and for that it is necessary to have adequate number of radiotherapy staff and requisite measuring, monitoring, and QA tools, dosimetric tools for obtaining the commissioning approval. So you have to submit all the details of staff and daily badges, QA tools you have brought to the ARB through AERB portal. And after getting the commissioning approval, you can conduct a radiation survey, and then you have to submit the survey report to the ARB. Then after approval to survey report, radiation related QA test like mechanical, electrical, and dosimetric test can be performed. And this also includes the machine acceptance test, like the machine you brought a machine from a supplier, then they do some test, and the tests are called machine acceptance test. And the collection after that the collection of all dosimetric data is collected for the commissioning of the treatment planning system. So after radiation survey, you got the survey approval, and then you are allowed to do all the dosimetric QA and collect the data for commissioning of treatment planning system. And after completion of all these process, you can apply for the license for operation through AERB portal. So you have to submit all the details of commissioning of the data for TPS, and after that you can apply for license through AERB. And after getting the license, you can start the patient treatment. So patient treatment begins only after the license approval. So this is the summary for establishing a radiotherapy facility. You can have a look. So after successfully establishing a radiotherapy facility, there are some ongoing compliance, like you have to maintain daily, monthly, and annually QA reports, and you have to submit safety status report every year by 31st January every year. And suppose you have used the machine for 10 to 15 years and you want to decommission it, then for that the institute has to intimate ARB, take the consent from ARB for decommissioning or the machine or source. So the key takeaways are ARB compliance is mandatory at every stage, every process step. You have to submit or intimate ARB by submitting an application through AERB portal, and your institute has to prioritize safety of staff in the radiotherapy for running a radiotherapy facility. So if you have any question, you are free to comment or ask a question. Thank you.